This conference will now be recorded.
Good morning, all. Am I audible?
Yes, ma'am. Ma'am.
I'm going to start the topic today. So we are going to start community ophthalmology from today. So in community ophthalmology, the first topic is regarding blindness. So what is the present scenario regarding blindness in India? So about 7.8 million blind people are there in India, while 45 million are visually challenged. Because I mean to say visually challenged, complete visual loss is there in about 45 million people. It accounts about 20% of the total population. So the estimated blindness, the estimated prevalence of childhood blindness is about adult blindness, the above thing, and now it is about childhood blindness. It is 0.8 per 1,000 children in less than 16 years age group, which is about, it means that about 3 lakh blind child are there in our country. So out of this adult blindness, 62% are blind because of cataract, 19.7 are blind because of refractive errors, 5.8% are blind because of glaucoma, and about 1% are blind because of cornea. So the most common causes of blindness which are treatable or preventable are cataract, refractive errors, glaucoma, and corneal blindness. So coming to definitions of blindness, there are various types of blindness. So the visual function, we can grade them into 4 levels according to international classification of diseases. First one is normal vision. Second one is moderate visual impairment. Third one is severe, and fourth one is blindness, which can be partial or total. So if you want to give certificate for a visually challenged person, we will grade the blindness according to this scale. So coming to what is normal vision. Normal vision is 20 by 20. That is 6 by 6 according to Snellen's chart. It means, what does it mean 20 by 20? That the test subject sees same lines of letters at 20 feet that a normal person sees at 20 feet. When a person want to see from a 20 feet distance, all the normal persons can see the same letter from the same distance of 20 feet. So what is the definition of visual impairment, which can be mild, moderate, and severe? So visual impairment is defined as the limitation of actions and function of the visual system. Any defect in the visual axis or visual actions or visual functions means it leads to visual impairment. So there is a special definition for low vision by National Eye Institute, which says that visual impairment not correctable by standard glasses or contact lenses, any medication or surgery, and also it interferes the ability to perform daily activities. Then we can say that the patient is having low vision. So it cannot be corrected by normal glasses or contact lenses. Any medical or surgical treatment is not useful in those patients, and it also impairs the normal daily activities of the particular person. Then we can say that the patient is having low vision. So there is another definition for blindness according to WHO and another definition by NPCB, that is National Program of Control of Blindness. So WHO, World Health Organization, if the visual acuity is less than or equivalent to 3 by 60 in Snellen's chart, then we can say that the patient is blind. Either it can be partial or total. So less than 3 by 60 means at 3 feet distance. You know what is 6 by 60, right? The first line in the Snellen's chart implies 6 by 60. 6 by 60 means at 6 feet distance, the patient is able to see the first line in the Snellen's chart. But it is 3 by 60 means at 3 feet distance as well, the patient is not able to see the first line in the Snellen's chart. Then we can say that the patient is having some blindness. So according to NPCB, counting fingers from a distance of 6 meters or 20 feet, from 6 meter distance, if the patient is not able to count the fingers shown by the practitioner, vision 6 by 60 or less with the best possible spectacle correction. These are all the criteria that the patient is decided whether the patient is blind or not. So vision with spectacle correction will be less than 6 by 60 and visual field less than or equal to 20 degrees in the better eye. Visual field is only 20 degrees in the better eye. These are the three criteria to be fulfilled by the person to be certified as blind by NPCB. So counting fingers at 6 meters is not possible by that person. And with spectacle correction, only 6 by 60 or less than 6 by 60 vision is there. And visual field is only 20 degrees in the better eye. So there are various types of blindness. These are all very important Viva questions for you people. Whether you listen or not, it's up to you. Economic blindness, social blindness, manifest blindness, absolute blindness, curable blindness, preventable blindness, and avoidable blindness. So according to WHO, so normal vision 6 by 6 to 6 by 18. If there is mild visual impairment, then less than 6 by 18 to 6 by 60. That is, the patient cannot see 6 by 18, but he can see 6 by 60 line in Snellen's chart. So severe visual impairment, also called as social blindness, less than 6 by 60 to 3 by 60. Patient cannot see 6 by 60, but he can see the patient's distance is reduced to 3 feet. He can see Snellen's chart first line. Now, economic blindness, less than 3 by 60 to 1 by 60. That is, he is not able to see at 3 feet distance, he is not able to see the Snellen's chart first line, but he can see it from 1 meter or 1 feet distance. Okay. Now coming to legal blindness, less than 1 by 60, but perception of light is present. He cannot see 1 by 60, but if you throw light on the patient's eye, he is able to perceive the light. Then it is called as legal blindness. And complete or total blindness, no PL, that is no perception of light. So this is regarding the visual field. Now coming to visual field, regarding to visual impairment. Now coming to visual field loss, if there is visual field is less than 10 degrees, but more than 5 degrees around the central fixation, if the patient is asked to fixate at a central point, if it is more than 5 degrees, but less than 10 degrees, less than 5 degrees around central fixation, even if visual acuity is not impaired. Even the visual acuity is okay, but the visual field is reduced to less than 5 degrees, then also the patient is supposed to be considered as blind. So economic blindness, I told you already, inability of the person to count fingers from a distance of 6 meters. Unable to count the distance at 6 meter difference, then it is called as economic blindness. Social blindness, less than 3 by 60 or 3 by 60 with visual field less than 10 degrees. Manifest blindness, 1 by 60, that is 1 meter itself, the 1 feet distance is also the patient is not able to see the first line of the Snell lens to just perception of light. Absolute blindness, there is no perception of light also. Again, the blindness can be dividable into curable, preventable blindness also. Curable blindness, that stage of blindness where the damage is reversible. It can be reversed by immediate prompt management. Example, cataract, pterygium, or refractive errors. So preventable blindness, the vision loss that could have been completely prevented by Institute of Effective Prevention and prophylactic measures. For example, if the patient is having optic neuritis, if we immediately start methylprednisolone intravenous, the patient will regain his vision within 10 to 11 days. But if the immediate prompt treatment is not given, the patient will go into optic atrophy and there will be visual loss. So this is called as preventable blindness. We can prevent the blindness by immediate intervention, but it is not. If it is not done, then the patient will going to become blind. So legal blindness, central visual acuity of 2 by 200 or less is better in the better eye with the best possible correction and visual field less than or equal to 20 degrees. So how do you prevent a preventable blindness? So we have to know the magnitude, we have to know the etiology, and we have to know how to control the progression of blindness. So what is the magnitude? 45 million are blind, 35 million are visually disabled. 60% of global blindness is in sub-Saharan African, China and India. So India is having more blindness population. 9 by 10 blind individuals in the world living in developing countries. So what is the prevalence of that? Blindness prevalence rate, how do you say? More than 1% in general population, then it is a significant public health problem. Previously, trachoma used to be a burden for the government to treat. Trachoma used to be, the prevalence rate used to be high. Nowadays, it is not like that. So WHO recommendation, national blindness rate less than 0.5%. In individual communities, it should be less than 1%. So what are the main common causes for blindness which are sometimes curable, usually curable? So cataract, glaucoma, age-related macular degeneration. These are all global blindness causes. It is about 68.8%. Other causes, most common is corneal opacities, which can be prevented or which can be reduced. The percentage can be reduced by doing keratoplasties. Diabetic retinopathy by control of diabetes and proper intervention by using anti-VEGFs and laser therapies. Childhood blindness, trachoma, onchocerciasis and others. So this is the etiology for blindness. Most common etiological factors. So in developed countries, most common is age-related macular degeneration, glaucoma, diabetic retinopathy and cataract. In developing countries, cataract is the most common cause, followed by trachoma, vitamin A deficiency, onchocerciasis and glaucoma. So you can see here, cataract is the most common cause. You can say about 46%. Childhood blindness, about including all the causes of childhood blindness, it is about 3.3%. Trachoma is about 12.5%, which reduced a lot these days. And onchocerciasis 0.6%. Others like glaucoma, retinal detachment, trauma, etc. It is about 7.5%. So India, this is the scenario at present. Cataract is the most common cause, 62.6%, refractive errors 19.7%, corneal blindness about 0.9% because nowadays corneal donor awareness was more and people started donating eyes. Glaucoma 5.8, surgical complications 1.2, posterior capsular opacification 0.9, posterior segment disorders like diabetic retinopathy, others 4.7, others 4.19. So what are the epidemiological determinants for this blindness? Age. In young and children, most common is refractive errors. High myopes are also, they are not being prescribed glasses till the age of 16-17 years because of lack of awareness. So refractive errors, trachoma, conjunctivitis, malnutrition, for example, vitamin A deficiency, which is also life threats, which may also lead to blindness by causing damage to the cornea. In adults, the most common is cataract, refractive errors, glaucoma, and diabetes mellitus, leading to diabetic retinopathy. So, sex prevalence, higher prevalence of trachoma and conjunctivitis and cataract in women, which leads to higher prevalence of blindness in women when compared to men. Malnutrition, infectious diseases of childhood, especially measles and diarrhea, PEM, vitamin A deficiency in the first 4 to 6 years of life, which is very important, which can be prevented. So occupational hazards, factories, workshops, people who are working in factories, workshops, industries are more prone for eye injuries. They're more prone to eye injuries. And also these people are more exposed to dust, flying object, gases, fumes, radiation, chemical burns. All these things may happen in these people. So social class, survey indicates that blindness is twice more prevalent in poor classes than the well-to-do families. Social factors, ignorance, poverty, low standards of personal and community hygiene, lack of affordability, lack of awareness, all these things are the social factors. So how can you prevent blindness? You want to prevent some preventable blindness causes are there, you want to prevent them, then how do you do that? So first of all, initial assessment is very important. Then there are various methods of intervention. It can be primary eye care, secondary or tertiary eye care. And also long-term measurements are required, and proper awareness regarding this is very important to prevent blindness, especially in glaucoma patients. You're supposed to counsel them a lot. You're supposed to ask them to take drops continuously throughout their life. That is very important. So methods of intervention, the first one is primary care. Wide range of eye conditions can be treated. Okay, so they can be prevented at the root level itself by locally trained health workers, who play an important role in prevention of blindness. So these are the local health care trainers. They were the first person who make contact with the community. They are also trained to refer the difficult cases to the nearest PHC or any district hospital available. So promotion of personal hygiene, sanitation, good habits, dietary habits, and safety in general, all these things will be done by these trained health workers. We also call them volunteers. So secondary care, normal conditions like cataract, trichiasis, entropion, ocular trauma, glaucoma, these can be managed at the secondary care level. It is provided usually in PHCs and also district hospitals where the particular department is established. We can also nowadays they are involving mobile eye clinics also, but it is not a good idea, I think, because we don't see more mobile eye clinics. Now coming to tertiary care, national and regional capitals, they are well established as medical colleges and institutions of medicines like LV Prasad Eye Institute and medical colleges. So sophisticated eye care such as retinal detachment surgeries, corneal graft surgeries, so glaucoma, drainage devices surgeries, all can be done there. So these facilities are not available at primary and secondary eye care centers. So rehabilitation comprise education of the blind in the special schools and utilization of their services in the gainful employment. So there are specific programs which are introduced by the government for prevention of particular diseases like trachoma control program, school eye health services, screening and treatment and health education for the school children, vitamin A prophylaxis, occupational eye health services. These are various programs which are started by government to reduce blindness. So coming to the final level of treatment modality, long-term measures. So patients should be given proper advice and counseling regarding poor sanitation, lack of adequate safe water supply, any poor nutrition and lack of personal hygiene, because these are the main factors that are responsible for eye diseases. So Vision 2020, the right to sight. The slogan is the right to sight. So this is how the global blindness scenario is there. See here, you can see how it is improving. So Vision 2020, I'll tell you what are the goals of Vision 2020. Prior to that, we'll know what these things are included in this Vision 2020. So WHO is included. Sorry, WHO is included. Ministry of Health is included. So National Vision 2020 bodies are there. From there to district vision service units are there. So NGOs will be professionals and corporate sectors. All these things will help, and IOPB is also included in this. So these are all the organizations that are involved in Vision 2020. So what is IAPB? International Agency for Prevention of Blindness, which is very important. So these all organizations will work cumulatively to reduce the blindness. So at district level, I told you here that district level services will be there. So at district level, IK team will be there. Equipment and supply of the needed drugs will be there, followed by community patients. These things will include in the district level implementation. So service delivery mode for Vision 2020, primary, secondary, tertiary, and advanced tertiary. Okay. So what are the principles of Vision 2020? Integrated, sustainable, equitable, and excellent eye care to the community. So IAPB, International Agency for Prevention of Blindness, founded in 1975, and it has about 108 members. So this organization includes international NGOs, professional bodies, universities, and corporate companies. So head office is present at London, UK, governed by the Board of Trustees and Council of Members. Vision, a world in which no one is needlessly blindness or visually impaired, and where those with unavoidable blindness, unavoidable vision loss can achieve their full potential. So what is the mission in Vision 2020? Promotes the global initiative Vision 2020, the right to sight, to eliminate the main causes of avoidable blindness by the year of 2020. So the main aim of this Vision 2020 is to eliminate or to reduce the causes of available blindness by the year 2020. It brings together all the government and non-government agencies also. It facilitates the planning, development, and implementation of sustainable national eye care programs based on 3 core stages of disease control, human resource development, and infrastructure development. So what are the diseases covered in Vision 2020? Cataract, trachoma, onchocerciasis, childhood blindness, refractive errors, and low vision. So Right to Sight is a global initiative for elimination of avoidable blindness along with WHO and International Agency for Prevention of Blindness. So this is launched by 1997, which is very important. This is an important Viva question for you. When it is launched in 1997. So a world in which nobody is needlessly visually impaired, where those with unavoidable vision loss can achieve their full potential. So the global initiative is to intensify and accelerate prevention of blindness activities so as to achieve the goal of eliminating avoidable blindness. This word is very important, avoidable blindness by 2020. Do by focusing on certain diseases, which I have told already. There are 5 diseases which are the main causes of blindness and for which proven cost-effective interventions are available. So they had made a global action plan from 2014 to 2019, which is called as GAP. So what is GAP? The vision of GAP is a world in which nobody is needlessly visually impaired, where those with unavoidable vision loss can achieve their full potential, and where there is universal access to comprehensive eye care services. So everybody has a right to sight. So goal is to reduce visual impairment and also to secure access to rehabilitation for the visually impaired services. So somebody is already gone with the vision, then they should be given rehabilitation along with the decrease of the visual impairment. So objectives: develop and implement integrated national health policies and ensure multi-sectorial engagement and effective partnerships. So this is about Vision 2020 and blindness. So do you have any doubts? Number 42. Number 42. 23. 23. 36. Number 4. Number 126.
Yes, ma'am.
So number 126, what is IAPB?
Ma'am?
What is IAPB? You know or you don't know? Are you in the class or not?
International Agency for Preventable Blind.
So when was Vision 2020 established?
What, ma'am? Mission?
Sorry?
I didn't hear you, ma'am.
Okay.
Mission?
Number 52. You can mute yourself, 126. Number 52. '96. 93. 74.
Yes, ma'am.
Number 74. Can you tell me the diseases included in Vision 2020? There are 5 diseases included in Vision 2020. At least 2 of them.
Cataract, ma'am.
Next,
Childhood blindness, ma'am.
anything else?
Trachoma blindness.
Okay, good.
Refractive errors.
Okay. So number,
Onchocerciasis.
okay. Number 14. Number 14. Number 9. '137. Number 30. 3030. Number 111.
Ma'am, 30 present, ma'am.
Sorry,
30, ma'am.
where were you till now? Just left the mobile outside and you're doing your own work, huh?
No.
Anyway, I marked you absent. 109.
Yes, ma'am.
Number 109. Can you tell me what is
Yes.
social blindness?
Vision 3/60 and visual field 10 degrees, ma'am.
Vision 3/60.
And visual field 10 degrees, ma'am.
Visual field 10 degrees. Very good. So your number is
109, ma'am.
109. Okay. Number 121. Number 16. 1616. Number 80. 8080. Number 3. Number 17. 1717. Number 77. So all these people will be marked absent. Whoever didn't respond to my this thing, they all will be marked absent. You can just inform them. Thank you. I'm closing the session.